Most people with diabetes concentrate on reducing carbs, taking medications, and monitoring their blood sugar. But there's a crucial factor they often miss: minerals. These essential nutrients help insulin function properly, protect nerve health, and lower the risk of complications. The issue? Many diabetics are deficient in key minerals that play a big role in blood sugar control. And without them, managing diabetes becomes much more challenging. In today's video, we'll uncover the top 3 minerals that are absolutely vital for diabetics. If you often feel drained, experience body aches, or find it tough to keep your blood sugar stable, this information could be a game changer. Stay tuned, because I'll also reveal the best food sources and supplements to ensure you're getting enough. 1. Magnesium. Magnesium is one of those essential minerals that often goes unnoticed until your body starts running low. For diabetics, this happens more frequently than most people realize. Every time blood sugar levels rise, the kidneys work hard to flush out the excess glucose. But in doing so, they also eliminate valuable magnesium. Over time, this continuous loss leads to a deficiency, making it even harder to regulate blood sugar effectively. The real problem is that low magnesium levels contribute to insulin resistance, meaning blood sugar remains elevated for longer, causing even more magnesium depletion. This creates a vicious cycle that many people don't even realize they're trapped in. What makes magnesium deficiency particularly tricky is that its symptoms often resemble everyday issues, making them easy to overlook. Muscle cramps, particularly in the legs and feet, are a common sign since magnesium is crucial for muscle relaxation. Constant fatigue, even after a full night's sleep, may indicate low magnesium because it plays a key role in producing ATP, the energy source for cells. Nerve-related problems such as tingling, numbness, or burning sensations also worsen with a deficiency. If you've been feeling more anxious than usual or struggling with sleep, magnesium depletion could be a contributing factor, as it helps calm the nervous system. Without enough of this mineral, stress hormones dominate, making relaxation and restful sleep more difficult. Even irregular heartbeats or palpitations can be a warning sign, as magnesium helps regulate heart muscle contractions. However, the effects of magnesium deficiency go far beyond just discomfort. It impacts several major systems in the body. In men, low magnesium can lower testosterone levels and weaken sperm, making conception more difficult, while in women it disrupts menstrual cycles and increases pregnancy-related risks. Libido can also decline because magnesium plays a role in hormone balance and blood circulation. The nervous system is particularly vulnerable, as inadequate magnesium slows down nerve repair, increases pain sensitivity, and accelerates nerve damage. The kidneys also suffer since magnesium helps prevent calcium buildup, meaning low levels increase the risk of kidney stones. Eye health deteriorates as well, as magnesium maintains the flexibility of blood vessels. When levels drop, oxidative stress rises, elevating the risk of diabetic retinopathy. The cardiovascular system takes one of the biggest hits because magnesium helps regulate blood pressure, prevents artery stiffness, and reduces inflammation. Without enough of it, blood vessels constrict, blood pressure rises, and the risk of heart attacks and strokes significantly increases. On a cellular level, magnesium is vital for insulin function. It activates insulin receptors, allowing glucose to enter cells efficiently. When magnesium is deficient, cells don't respond properly to insulin, making blood sugar management more difficult. Additionally, magnesium is essential for ATP production, which powers the body's energy supply. Without it, fatigue and sluggishness become the norm. Magnesium also regulates calcium within cells, and when levels are low, calcium accumulates where it shouldn't, leading to muscle stiffness, inflammation, and oxidative damage. The good news is that restoring magnesium levels is possible by incorporating the right foods into your diet. Pumpkin seeds are an excellent source, with just 1 ounce, 28 grams, providing around 40% of the daily requirement. Cooked spinach is another powerhouse, delivering about 38% of the recommended intake per cup. Almonds make a convenient snack, supplying around 27% per ounce, while dark chocolate is not only a delicious treat but also provides 24% of the daily magnesium requirement in a single ounce. Avocados are another easy and nutritious way to boost intake, offering approximately 15% per medium-sized fruit. These foods not only replenish magnesium levels but also support overall blood sugar control and health. For those looking for more gourmet ways to increase magnesium intake, Several high magnesium meals can help. A Japanese miso-glazed salmon with sesame spinach provides over 60% of daily magnesium needs, while also supplying heart-healthy omega-3 fatty acids. A French almond-crusted halibut with sautéed Swiss chard delivers around 50% of the recommended daily magnesium intake, while supporting insulin function. If you're in the mood for something indulgent, a black truffle and dark chocolate mousse can satisfy your sweet tooth while supplying over 40% of your magnesium needs. If dietary changes aren't enough, supplements can be a helpful solution. However, not all magnesium supplements are created equal. Magnesium glycinate is one of the most effective forms because it is easily absorbed and gentle on the stomach. A great option is Thorne Magnesium Bisglycinate, which provides 200 mg per capsule and supports nerve function and muscle relaxation. Another excellent choice is Doctor's Best High Absorption Magnesium, which also contains 200 mg per tablet in a chelated form for better uptake. These options are far superior to magnesium oxide, which has poor absorption and can cause digestive discomfort. Just as important as getting enough magnesium is avoiding the things that drain it from your system. Refined carbs, such as white bread, pasta, and processed grains, are stripped of magnesium, offering little nutritional benefit. Excess sugar is another major culprit, as insulin spikes force the kidneys to eliminate even more magnesium. Caffeine, especially from energy drinks and sodas, can block magnesium absorption, while alcohol significantly depletes magnesium and interferes with how the body utilizes it. Even excessive calcium intake, particularly from supplements, competes with magnesium for absorption, worsening deficiencies. If you've been feeling constantly drained, dealing with muscle cramps, experiencing nerve pain, or struggling to keep blood sugar under control, magnesium deficiency might be the missing piece of the puzzle. The good news is that with the right food choices, smart supplementation, and by avoiding depletion triggers, you can restore healthy magnesium levels and improve your overall well-being. Your body depends on this powerful mineral, so make sure you're getting enough. 2. Zinc. Zinc is one of those overlooked minerals, yet for diabetics it plays a crucial role in maintaining overall health. The challenge is that diabetes accelerates zinc loss, making it much harder to maintain adequate levels. Elevated blood sugar leads to increased urination, and with every trip to the restroom, more zinc is flushed out of the body. The pancreas heavily depends on zinc to properly produce and release insulin. Without enough of it, insulin function slows down, making it even more difficult to regulate blood sugar. Chronic inflammation, a common issue in diabetics, further depletes zinc since the body uses it to counteract oxidative stress. Additionally, certain medications, including diuretics and ACE inhibitors, can contribute to zinc deficiency, making the problem even worse. One of the most frustrating aspects of zinc deficiency is that it doesn't always have obvious warning signs. One major clue is slow wound healing. If minor cuts or scrapes seem to take forever to repair, low zinc could be the culprit. Another red flag is frequent illnesses, as zinc plays a critical role in immune function. If you find yourself catching colds more often than usual, your body might be signaling a deficiency. Uncontrollable sugar cravings can also indicate low zinc, as this mineral helps regulate both insulin and appetite. Skin-related issues, such as dryness, acne, or persistent rashes, can point to inadequate levels since zinc is essential for collagen production and skin regeneration. Other symptoms include a reduced sense of taste and smell, white spots on fingernails, and even hair thinning. Since zinc is involved in nearly every major bodily function, its deficiency can lead to widespread disruptions in health. Reproductive health is another area where zinc plays a vital role. In men, low levels lead to reduced testosterone production, a lower sperm count, and sluggish sperm movement, all of which make conception more difficult. For women, zinc deficiency can contribute to irregular menstrual cycles and hormone imbalances that make pregnancy harder to achieve. Additionally, both men and women may experience a drop in libido since zinc is closely linked to testosterone levels, which influence sexual desire and energy. The nervous system also suffers without sufficient zinc, as this mineral helps protect nerves from damage. In diabetics, a deficiency can worsen neuropathy, leading to increased tingling, burning sensations, and pain. The kidneys, too, are affected, as zinc helps regulate inflammation, and without it, the risk of kidney disease rises. Vision problems are another concern since zinc is crucial for retinal health. Low levels can make diabetic retinopathy more severe, increasing the risk of vision loss. Zinc is also a powerful protector of the heart and blood vessels. It helps keep inflammation in check, prevents arteries from stiffening, and assists in regulating cholesterol levels. A deficiency can lead to an increased risk of heart disease, high blood pressure, and strokes. On a cellular level, zinc is critical for insulin function, as it allows insulin to bind to receptors and transport glucose from the bloodstream into cells for energy. When zinc levels drop, insulin becomes less effective, leading to higher blood sugar and worsening insulin resistance. The pancreas also requires zinc to store and release insulin, so a deficiency makes blood sugar regulation even more challenging. Furthermore, zinc acts as a strong antioxidant that fights inflammation and oxidative stress. Without it, cells become more vulnerable to damage, age faster, and function less efficiently, worsening diabetes-related complications. The best way to replenish zinc levels is through diet. Oysters are by far the richest source, with just 3 medium-sized oysters providing over 200% of the daily zinc requirement. Beef liver is another powerful option, offering around 80% of the daily needs in just 100 grams. For those who prefer plant-based options, pumpkin seeds are an excellent choice. Just 1 ounce, 28 grams, delivers about 50% of the daily zinc requirement. Grass-fed beef is another reliable source, supplying approximately 40% per 100-gram serving. Chickpeas, though lower in zinc, still provide around 25% per cup when cooked, making them a good option for vegetarians. For those who appreciate gourmet cuisine, there are plenty of delicious ways to increase zinc intake. A Japanese-style oyster sashimi with ponzu sauce delivers over 200% of daily zinc needs in just 100 grams, making it one of the richest zinc-packed dishes available. French beef tartare with a raw quail egg yolk provides about 90% of the daily requirement, while also supplying bioavailable iron. A Mediterranean-inspired dish, such as grilled lamb chops coated with a toasted pumpkin seed crust, delivers around 80% of daily zinc needs, along with vital minerals that aid insulin function and hormone balance. If dietary intake isn't sufficient, high-quality zinc supplements can help fill the gap. The most effective forms are zinc picolinate and zinc bisglycinate, as they offer superior absorption. Thorne research. Zinc picolinate provides 30 mg per capsule and is gentle on the stomach, making it an excellent choice. Another great option is Now Foods zinc glycinate, which contains 30 mg per tablet in a chelated form for optimal absorption. Most diabetics benefit from taking 15 to 30 mg of zinc per day. But since zinc competes with copper for absorption, long-term supplementation should be balanced with adequate copper intake. However, certain foods and habits can interfere with zinc levels, making deficiencies worse. A high-sugar diet is one of the biggest culprits, as it increases insulin demand, leading to more zinc being lost through urine. Whole grains and legumes contain phytates, which block zinc absorption, though soaking or sprouting them can help reduce this effect. Excess calcium, especially from dairy or supplements, competes with zinc for uptake, making it harder for the body to absorb. Alcohol is another major problem. It depletes zinc while simultaneously increasing inflammation and worsening insulin resistance. Processed junk foods further contribute to depletion, as they lack essential nutrients and promote chronic inflammation, draining zinc levels even further. Despite being one of the most underrated minerals, zinc is absolutely essential for diabetics. Without it, insulin function declines, blood sugar regulation becomes more difficult, and the risk of diabetes-related complications skyrockets. Boosting zinc levels through nutrient-dense foods or high-quality supplements can significantly improve insulin sensitivity, protect nerve function, support heart health, and even enhance fertility and libido. Additionally, maintaining optimal zinc levels can speed up wound healing, curb sugar cravings, and strengthen the immune system. By making zinc a priority, diabetics can take a proactive step toward better overall health and improved quality of life. 3. Chromium. Chromium is one of those minerals that rarely gets the attention it deserves, but if you're dealing with diabetes, it plays a much bigger role than you might think. Your body naturally loses chromium through urine, and the higher your blood sugar, the harder your kidneys work to flush it out, taking chromium along with it. This depletion happens even faster if you consume a lot of processed carbs or experience chronic stress. Unlike some minerals, your body doesn't store much chromium, so it's crucial to get enough through your diet or supplements. One of the biggest challenges with chromium deficiency is that it mimics common diabetes symptoms, making it easy to overlook. If your blood sugar has been harder to manage despite following your usual routine, low chromium levels could be the culprit. This mineral plays a crucial role in insulin function and appetite regulation, so when you don't have enough, your body struggles to control sugar cravings and hunger. Feeling constantly tired, mentally foggy, or sluggish. That could be another clue. In some cases, low chromium can even contribute to mood swings or anxiety because it supports brain function. If the deficiency becomes severe, you might start noticing tingling or burning sensations in your hands and feet, as unstable blood sugar can put excessive stress on your nerves. Chromium's influence extends far beyond blood sugar control. In men, inadequate levels can lower testosterone and sperm quality, making conception more difficult. In women, it can disrupt hormonal balance, leading to irregular cycles and fertility challenges. Energy levels and circulation also take a hit, which can result in a reduced sex drive. Additionally, chromium plays a role in nerve protection. Without enough of it, blood sugar fluctuations can become more extreme, accelerating nerve damage. The kidneys are another area of concern, as chromium helps shield them from oxidative stress. When levels drop, kidney damage from high blood sugar progresses more rapidly. The eyes are also vulnerable. Low chromium levels have been linked to worsening diabetic retinopathy, increasing the risk of vision problems. Heart health is another major reason to pay attention to chromium intake. This mineral helps regulate cholesterol and fat metabolism, and when it's lacking, bad cholesterol levels rise, arteries stiffen, and the risk of heart disease escalates. On a cellular level, chromium acts as insulin's assistant. It's a key part of the glucose tolerance factor, which helps insulin transport sugar from the bloodstream into cells. Without sufficient chromium, insulin's effectiveness weakens, causing blood sugar levels to remain high. This forces the pancreas to overproduce insulin, worsening insulin resistance over time. Additionally, chromium aids in breaking down carbohydrates and fats. When you don't get enough, your body struggles to use glucose efficiently, leading to fatigue and increased susceptibility to weight gain. Fortunately, boosting your chromium levels can be done naturally through the right foods. Broccoli stands out as one of the best sources. Just half a cup provides about 50% of your daily needs. Grape juice is another good option, with 1 cup offering around 40%, though diabetics should consume it in moderation due to its sugar content. Brazil nuts are a fantastic source, with just 1 nut delivering roughly 30% of the daily requirement. Lean beef is also beneficial, with a 3-ounce serving providing about 25%, while eggs contribute a smaller but valuable amount of 10 to 15% per egg. If you enjoy gourmet meals, certain high-end dishes pack a strong dose of chromium. A Japanese Wagyu steak paired with sautéed broccoli and Brazil nut pesto delivers over 75% of your daily chromium needs, while also providing healthy fats and protein to support stable blood sugar. A Mediterranean-style grilled lamb chop served with rosemary-infused grape reduction and steamed asparagus provides about 60% of your daily chromium intake while promoting heart health. For a more indulgent option, a French-style duck liver pâté with poached eggs and truffle-roasted mushrooms offers close to 50% of the daily requirement while also supporting insulin function. If diet alone isn't enough, high-quality supplements can help bridge the gap. The best forms for absorption are chromium picolinate and chromium polynicotinate. A solid choice is Now Foods chromium picolinate, which provides 200 micrograms per capsule, enough to support blood sugar balance without overloading your system. For those with more severe deficiencies, Thorne Research chromium picolinate offers 500 micrograms per capsule. Since the body only needs small amounts of chromium, it's best to start with 200 to 500 micrograms per day and monitor how your blood sugar responds. Just as important as increasing chromium intake is avoiding foods and habits that deplete it. Diets high in refined sugar and processed carbohydrates are the biggest offenders as they increase insulin demand, causing more chromium to be lost through urine. Excess dairy can also interfere with chromium absorption, as calcium competes with it in the body. Processed foods like white bread, pastries, and sugary drinks not only strip chromium from your system but also worsen insulin resistance. Alcohol is another major factor, as it speeds up chromium loss and makes it harder for the body to maintain stable levels. Chromium might not be the first thing that comes to mind when thinking about diabetes management, but it's a critical player in keeping blood sugar stable, improving insulin sensitivity, and supporting metabolism. If you're struggling with intense sugar cravings, erratic blood sugar levels, or constant fatigue, increasing your chromium intake could make a real difference. If you found this information valuable, don't forget to hit the like button and leave a comment below. Let me know, do you think you're getting enough chromium, or is this something you need to focus on? And if you're serious about taking control of your health, make sure to subscribe because we've got plenty more game-changing tips coming your way. Thanks for watching, and I'll see you in the next one. Take care and stay healthy.